is technically supposed to be just a really, that is a huge topic, and one that we've been getting a lot of consults for. And we have a lot of people joining, so we're going to wave them as they join, because this is our fifth week now doing this. And what I found is as we get into different topics, some people join for that. We have several people joining on Instagram. Yolanda just joined us on looks like on Facebook. I think that's my Facebook one. And that one is YouTube. And this one is Twitter. We have a few Twitter joining. We have a lot of people joining on Instagram. I think Instagram is the wave of the future. But anyway, so face is complex. You know, we all want to have good-looking face. The problem is with a good-looking face comes some either surgical intervention in which the face gets tightened surgically. So I can do what they call mini lift, including a brow lift. And face and eyes go together. So you'll have upper lid left, lower lid left, and I'm going to show you some pictures I have on my computer. And you know, face is it's very people because you have to get it right 100% all the time, because it's the first thing people see, and people are very, very into how they look, especially face and nose. We'll get into probably rhinoplasty. Have we done that yet, Stephanie? Did we do rhinoplasty? Did we do it last? Okay. We'll do a whole one on rhinoplasty next week. That takes its own, that's a whole different topic, is rhinoplasty. But remember, any of you guys want to talk more about this, I'll do virtual consults with you. We can do it at the end of tonight. We can do it tonight as well. Had a bunch of people wave. Hello, everybody on Instagram. Lots of people are joining. Stephanie just added how you can schedule a free consult, and we have a text to call number, 210-270-8595. And I think, Stephanie, if you can get on to join Instagram and say the same thing, that will be good. So let's get back to face. The face is divided into thirds. The upper, the middle, and the lower should all be in the same proportion. So technically, this area is a third, then this area is a third, and then this area is a third. As you have hair loss in the top, this is going to stretch up. If you lose bone in the mid-face or you have a shortened chin, this is going to be out of proportion. Montreal joined us. Oh, my Lord. Myral Safina. I think that's how, if I butchered your name, I'm so sorry. Lisa Rogers says, hi, Doc, on Facebook. Hey. So when I look at the face, I look first at the upper, middle, and the lower part of the face. Then I look at jaw lines and how the face is structured. You want to have this face be the widest part of your anatomy, because when this is the widest part of your anatomy, it triangulates your face. And when it triangulates your face, you look skinnier. I mean, just in general. This is called the bizygomatic distance. I know that sounds like a lot. I've been waving at everybody. Thank you very much for coming in. Instagram, we appreciate you. Lots of waves, lots of hugs. Iris just joined us, so thank you, Iris. And Stephanie is putting up on everything. And Stephanie, can you get to Twitter too? Stephanie will be helping to monitor. I'm just going to wave at everybody that comes in on Instagram. So first I look at there. Then I ask, nasolabial folds, are you looking for your eyes, your upper lip? What really bothers you? And you can't just say everything when you come see me. I mean, you got to like get down to a few things that I can at least talk to you about. Sorry, my hair is going ballistic over here. I may just have to put it down. Water, please. Did you drink out of this? Ugh. I need like some water or something. Maybe you can go in the kitchen. I'm gonna have the production manager here go run around and get some water because my hair is sticking out. So anyway, back to this. One of the things about having this look at you, my sister is on. You see that, Stephanie? Say hello to sister. Elaine from New Zealand is watching. My buddy, And it's awesome you're watching. And Fresh, my sister's watching. And Janie Hernandez, hi, Dr. Jeneby, how are you? Missy, hello. Nice for you to watch. Y2E, it's the New Zealand hello from Elaine. Buy her wine, by the way. If you want to get a good wine, call Elaine. Oh, that's okay. Anybody who's on Twitter that wants to know, we are doing virtual consults tonight. So anyway, the thirds of the face, upper, lower, medium. I also look at skin. Is your skin needing something to refresh? Because sometimes the skin not only sags, but the face not only sags, but then you have a skin problem. So I look at it in two ways. I look at it as, is this a skin problem or is this a sagging problem? Oh, Molly Raina is here. See you on Thursday. See ya, Melissa Raina. Her tag is Molly Raina. So Melissa Raina, I'll see you Thursday. Thank you for checking in. Ginwan Gonzalez just started watching. Man, Straha Morales starting to watch. So anyway, we're getting this area. I look at skincare, skin quality to see how that looks because you can't fix skin quality. Oh, Lord. My director of production, Ashley Jeneby, just gave me my gel, thank you. Because my hair is driving me insane. I should have done this off the air, but we're not all perfect. There you go. Woo! Much better. This is the gel I use. It's not expensive, but it works. So anyway, wrinkles, wrinkles can be, it's better to be using something for wrinkles. My goodness, Elaine Walker, my buddy, who I met in New Zealand, is back in Fiji where I met her. I'm so jealous. And we just put up a special on Facebook. We're going to put a special on Instagram as well, which is $500 a face or nose or ear pitting today if you text us today at 210-270-8595 and give us your name, your email, and your phone number. So back to here. We're getting a lot of people joining on Twitter, Instagram, and Facebook. All of you guys, welcome. Emil Khan just gave us a thumbs up on Instagram. So now I look at the area under the eye. This is called the mid-face, and I look at the jowls. Most people are sagging. As we sag from the need a facelift, also need a neck lift. And let me tell you guys and gals, a great neck lift looks awesome. And I'm gonna wave at some of these fans here. They've been waving at me. It looks awesome because there's nothing really to tighten the neck as good as a neck lift. I know these machines are out there, but they just don't do a good job. I mean, the best neck lifts are always by board certified plastic surgeon or core physicians that do this on a regular basis. And I almost always do a neck lift with every facelift because you cannot, if you pull this up, but then we can also do some face tightening with lasers. For example, at the time of your facelift, I can laser your face. And my buddy Eric Williams, the best urologist in the country, just texted me on Facebook from his home in Missouri. I hope it's Missouri, bro. I can't remember where. There's a Missouri, right? Yep. He said that. Good. So when I laser the top layer of skin, it becomes smooth. Then we lift the bottom layers. And I'm going to show you a little video or a little thing I put together for you guys just on this topic that you can see. And let me get this all tightened up for you guys here. And here we go. And something called face, eyes, and ears today. So I'm going to try to put it so that you guys can all see it or a little bit of it. Some of my YouTube fans won't be able to see it. But right now, the major fans are on Twitter and Instagram. So look here. So if you look here at the faces, once you do the faces, you're able to cut the skin, lift up. You can lift up in several directions. You can lift up in several vectors depending. Most people get this kind of like an oblique vector. Oblique means not quite up, not quite laterally, kind of at maybe I would call 30-degree angle. And what that does is it pulls the skin up. You can see here. So those are three different types of ways that we do facelifts. Either completely vertical right here, almost completely oblique, and sometimes completely lateral. It depends. Once we pull that up, it ends up pulling up all the saggy skin from the lower part of your facelift. Gorgeous. You started out with jowling on each side. I also augmented her lips a little, upper lid, lower lid lifts, and a brow lift. And look at her there. That's only at 6 weeks after surgery. Can you imagine the difference? I mean, she looks like a rock star. So I wanted to show you guys this lady, and she's on my website, and these are not parlor tricks. This is real. And this is a lady who had a facelift. So I wanted you guys to see that the power of this. And I get a lot of people who say, man, some people think that you can take 15 years off somebody and really starting to enjoy these procedures. This lady I just did, she went from this kind of a mad face, we call it, to happy face. Look at the difference in her. It's a little overexposed, but she still looks fabulous. But imagine how much she enjoys her life. You could tell the difference. She is smiling in here. We did not ask her to smile. We try to get everybody not to. But some patients just can't help it. They just smile. If you could see her.
Bring it a little bit more this way.
What's that?
For Facebook, turn it a little bit. Left.
Yeah, right there. It's a little bit behind. So as you can see Facebook, that you can see the difference before and after. Before and after. Some of these patients just can't help it. So you can see also with eyes. Oh man, my director of comments just walked up. It's Ashley Jeneby. Eric Williams just said hello, by the way. So if you look at this lady's puffy eyes, so now let's get into some eyes. You see these puffy areas around the eyes? Sure, you could try to fill them with filler. Nah, that ain't gonna work. You can try to camouflage them with different lasers. It's okay. But really, you want to get at the meat of the bones, you're going to have to do some kind of a lid lift. And so you could see here, we'll bring them to all of them, that she got, bags are gone, and she is ecstatic. She looks like a different person. And she's super happy, super happy. We'll talk about the eyes now. So a lot of times I combine a facelift with the eyes. And because you can't just lift up on the face without having some crinkling, you can if you just do a mini facelift. And a lot of times I'll just do a mini facelift and not do the eyes, which is fine too. It's all good. And we have some Hurricane Ashley joined. That's my director there. We just got a question on Instagram. Do you have to have after a facelift? Yes. I mean, the facelift is just the beginning. And what you're going to have to do is make sure you maintain. I mean, your body is like a car, right? So you can't just get one oil change. And, you know, even with the face fully tightened, you still need some volume. Now, sometimes we use fat, sometimes we use filler, but something to push out deflation of the face, and then something to shrink the wrapper. So once you add some inflation of the face, then you shrink the wrapper, shrink it, you get this enormously powerful pull, and it ends up being gorgeous. So we have a lot of people joining us on Instagram, on Facebook. We really appreciate it. We appreciate you taking your time out. I try to do this when you're at home and things are a little bit easier on you. You get your kids around, you're doing your thing, and good luck next week. Most of you guys are taking your kids to school. We actually have a couple of openings on our surgery schedule, which usually aren't very doesn't happen a lot, but it's only because it's back to school, and we know how tough it is to be a mom or a dad. So I congratulate that. So back to eyes. Sometimes I'll fill this area of the eyes, especially when you have dark circles. You can camouflage the dark circles of the eyes using a filler. And when you have a filler, camouflaging that area, the only problem with that, eventually, you're going to need more fillers. So you're always going to go to someone that has tons of experience with the eyes. And I don't mean someone that's just been injecting for 2 years. Okay, that's not tons of experience. I've been injecting now over 17 years. I have at this point, let's see, I would say something in the realm of 25,000 to 30 to 40,000 different types of injections on the face, because I've had now thousands of patients come through, and if I have 2,000 or 3,000 patients or 4 come through me in the spa every year, and before I had the spa, I was doing them all, and each one gets 10 injections a year. That's 20,000 right there. Bella Williams, awesome to see you. This is Dr. Williams' awesome daughter, who I knew when she was real little. And so I was able to hold her under 1 year old. So welcome, Bella. I also sent you a signed copy of my book, and I hope you're reading it because it's awesome. So a lot of guys complain of this extra upper lid skin. To get rid of that extra upper lid skin, you need to like cut the area. But in women, if you don't tack the area up, tacking meaning pull it up, using called compensated brow ptosis. It's a very complex word. Joy will drop because the body says, oh, I don't have upper lid skin anymore, so it actually makes it worse. So in guys, even when I cut the skin, the brow can drop some, so they just get heavy brows. But guys are used to heavy brows. And the only other problem with guys sometimes is if they're bald, you can't make cuts up into the top. So I have to look at your hairline. I have to understand what you're doing. Occasionally, you can do a super brow lift, where you can make an incision in the top of the brow and place a fixation type, either something that fixates the brow that is very easy to put in, or you just have to deal with not being able to fix it. Where are my scars with that? So the scars in the forehead lift are right within the forehead lift. Say how's watching. Hey on Facebook. Thank you for watching. Several people have joined us on Instagram. Holy moly. So the scars up in the brow lift in women are here. I do it in a zigzag, and I do it across the hairline, and I do it so that you can see that you don't have to see the scar, and that the hair grows through the scar. It's a little trick that we use, that we've learned as plastic surgeons to do this. So that'll pull the brow up, and a lot of times 80% of an upper lid is the brow, and I have a heavy brow, and at some point one of my buddies is going to do it. But look when you lift up or when you pull away these brows, you look a lot better. And a lot of women don't know that it's their brow until you're actually showing them that 80% of their problem is a brow problem, 20% is upper lid skin. Who knew? The bottom line is you can combine a face tightening with a laser resurfacing, with a neck lift, and upper and lower lid bleph, or bleph is a fancy word for lower lid surgery and upper lid surgery, and then combine that with a brow lift. So, excuse me, I'm a little jet lagged from our vacation, so if I yawn a few times, that's cool. Alva, Lizette give us a nice little smiley, I love you bitmoji. Melissa Rainia's watching, thank you very much. So the upper lid skin incision is right, I make it about 8 millimeters above what they call the tarsal fold, so that when you open your eyes and you're looking up straight at someone, you don't see the incision because it's covered. As far as the incision for the facelift, it comes down the front of the ear, inside the ear, on the lobule, the back of the head, and down your hairline. And why is that important? Because I try to hide it, because I know you women like to wear your hair up in a bun. So Dr. Jeneby, finance manager, who is Stephanie, is giving you lots of good stuff that you need to know about our financing. Dr. Williams has just planted a question, which is awesome. I didn't tell him to, but he's my friend. As far as the head and neck would be a facelift, upper lid left brow, and neck lift, called the full Monty, from head to toe, because you're rejuvenating. And I think, and people can tell me yes or no, that if you're trying to look younger, the only other problem with that is that a procedure like that takes about 2 to 4 weeks to heal up from. And a lot of people don't want that. That's why they're going to these thread lifts, which don't work more than a year. And even the companies will tell you that. But we'll do something for you. If you have something that you need to be at, you can't have a lot of downtime, we can do a little thread lift. We use our own types of threads. It's basically the same thread I use in a facelift, although in a facelift I tighten it a little harder and I'm open and looking.
What if I'm in my 40s?
So I have seña genial en español para los no sabemos en español. Like, no sabemos. We'll get somebody to translate that, but
So what if I'm in my late 30s?
oh, okay. I'm sorry, but I don't know how this thing can translate
Okay.
in Spanish. Can you translate?
I'm doing it right now.
Wait, Facebook lets you do
It would be great in Spanish for those of us who don't know Spanish.
yeah, that's what I know. That I heard Stephanie just told me that, but that is great, Daniela. Muchas gracias. Como se dice? Oh, Seha can translate 100%. That's awesome. But I don't know how you're going to do that while I'm talking, because I'm going to be talking a lot. But if Daniela, you want a transcript of this, ¿quieres un transcript? Is it transcriptos? I'll transcribe it in Spanish, right? This will be uploaded to YouTube. Gracias from Daniela. De nada. Muchas gracias. Maybe someday we can meet in my office. Oh, Michelle Kasner says it has a translate button. Does Facebook have a translate button? Oh,
Instagram does.
no, Instagram has a translate button. Okay, we gave you a little translation here, but again, we're going to upload this to YouTube, my YouTube channel,
I'll put it on.
and Seha's translating for me. And once we translate it into YouTube, it will translate into Spanish, right? Automatically.
Yeah.
See, so, ¿cómo se dice translate automatically in Spanish? I think we're out here. El tele. But we do have a Spanish person that will do consultations in Spanish, and I will be in the room, and I can speak a little, and I can understand a lot. So just bear with us. You just have to turn it on. Seha says, don't trust that. Okay, so,
Traducir, automatic.
but anyway, so we have the eyes.
That's how
What's
you
that?
say it.
Traducir, YouTube traducir automáticamente en español, Daniela. Okay? So, thank you. I'm just going to show you my man here is behind the scenes. Joe John, the best videographer on this planet. He's open for business. He can do anything you want. He does a lot of clients, but he likes me the best. I'm just going to show him real quick. Oop, you got to get off there now, dude. And then here he is on Twitter. Joe John, if you need him, anybody, let me know. Daniela, mucho gusto, okay? Again, back to where we started. So a lower lid, upper lid, brow lift, cheeks, and neck are awesome. Now, oh, thank you. Michelle Kasner, gracias por todo, okay? We just got back from Spain, so I learned a lot there too. So now we're going to go to a little bit of ear surgery. A lot of people have, they come to me and they'll have their ears sticking out. That's called an otoplasty. Otoplasty. Robert Spain is watching. Oh, Helen Guerrero, translate traducir. Muchas gracias. Necesito hablar más español. Entiendo mucho. So I'm going to show you some pictures of women who have gotten their ears done and the difference in their lives. Now look at this. Look at this lady. You can tell that what they have here is they have a deep concho bowl, and I'm going to wave at all you guys here, and I appreciate you coming in. Deep concho bowl. You can see there her ears. I'm going to show you Facebook here. Deep bowl right there. Okay. And what happens is if you have a deep bowl and then you lose your anti-helical fold, you're going to need to remove some of the bowl and then pull this back. And then you get something like, not like that, but sorry. If you don't screw up once or twice, you're not doing well. So here you go. You can see her ears are completely different. She's much happier, does not have that. Okay, so here we go. Son fotos de antes. Oh, thank you, Seha. That's real nice of you. And here I have, hello, I am 49 on Facebook and my lobes are getting longer. Oh, no. Well, listen, that's not this problem, but I do take care of earlobes. I take care of a lot of people who have gauges, who eventually need to find a job or go into the military. And the job may not be again, back to the ears. And a lot of people may be going into the military, but the military does not allow to, they don't like you to have these long or big gauges. And having earlobes like that, having gauges like that is not professional. So they make us come in. Hello, happy Tuesday, Doctor. How are you today? Sending love from Myra Rodriguez. Thank you, Myra. Imelda Mendez Yamasaki is watching. Alicia Jakoviak. I'm sorry, I don't have my glasses on. Oh, this is one of the many things I sometimes forget, especially when I'm off work. But hey, this is my time, so enjoy it. Back to ears. Some people get their ears done when they get their breasts done, or I've had guys get ears in their chest, abdomen. I've gotten people do their ears during a facelift or tummy tuck. Angelique Thomas says, love Spa Black. We love Spa Black too. Appreciate it. We actually are doing private live consults, and there's the, if you guys want to do that, Seha says, los resultados son excelentes en la reconstrucción de oídos and also you have other surgeries in reconstruction de oídos. I hope I said that right, but I read it straight off her thing, and I think I got most of that right. So thank you, Seha. Very, very nice translation for us. Sandra Del Boss loves Spa Black. Thank you very much. We really appreciate it. I love the place, too. I get a lot of my Botox, all my stuff. I'm going to be getting some carbon dioxide resurfacing because you want to keep your skin from not only getting what they call dynamic wrinkles like this. Static wrinkles means that it stays in there. And the way to reverse that is multimodality, meaning you're going to need a Botox for long periods of time, and you're going to need to resurface your face. Alicia Jakowiak says, it's okay, Jello Wick. Okay. So back to the face, back to the eyes. So when I start to see you, I start to ask a few questions. What is it that you're looking at? We're going to wave at a few people. Laura Alverman, hello, doctor. I would like to find out about facelift. Do you have pictures before and after? I do. They're on my website. We're going to show you the website. I showed you here some pictures here. Let me show you. Right here, Laura. If you're looking here, that's a before. Not so great. And after. But she had upper face, upper lids, eyes, facelift, and neck lift. So Helen Guerrero is not really worried about her face. Again, look how pretty she looks. She even got new hairstyle. And it's amazing is because when people get these procedures done, they get new hairstyles. They get new boyfriends or girlfriends. Guys get them too. Guys get a lot of neck lifts and upper and lower lids. They also get a lot of neck surgery. And you wanted to see another one. Here's another lady I just finished. She's about a year out. Look at the difference here. I mean, she started out kind of grumpy, and this is happy. We did not tell her to smile. That just makes her smile. Laura Farias, Dr. Jeneby, I know you're not talking about this tonight, but I'm a gastric sleeve patient. Do you specialize? Yes, I do. We do a lot of body lifts, lateral thigh lifts, buttocks lifts. We do multi-surgeries all the time. So please call us or text us 210-270-8595. You can text us your information. I can look at you tonight on a virtual consult as well on this computer here. I'll be waiting for you to jump into the doxy room. If you don't know where the doxy room, and the great part about it is I can just do a private consult with you and that's it. Nobody else will see you. So just jump into the doxy.me room. Say, estas son fotos cirugías de las canas. To schedule a free consult, please call Stephanie 210-270-8595. Let me see what else there goes. Helen Guerrero says, I'm not worried about my ears. Double chin runs in the family. Yes, we can lipo the neck and do a neck lift as well. Is it time to walk the dog? Yes, it is. So I'm going to set up the doxy.me for anybody who wants a visual, wants to come into the room. Good evening. I know you're not talking. Okay, so I went over here. So we set up the YouTube where you can look on YouTube. We gave you the schedule the free consult. Hannah Henderson says, yay, Dr. J. Hannah's one of our awesome estheticians. It's also working the front desk at Spa Black. If you've been there recently, you know that Spa Black is awesome. We have a great crew. And Hannah is an integral part of that crew. And she's starting to get more clients. She's the only one that's, at this point, taking almost new clients. Because all the other girls are booked out for some of them 6 to 8 to 12 weeks. So Hannah, we're gonna get you busy, I promise. She's already starting to do some facials. She's learning about doing PRP to the hairline, like lasering the top of the hairline, then adding a PRP. I also do hair transplant as part of the face. Hair transplants are awesome because we take hair from the back of your head, okay, that is resistant to the effects of DHT, which cause you to have a receding hairline. And we place it in the front, the vertex. I call this the basketball part of your head because when you're watching basketball and you're at the lower end of seats, people can see the back of your head. So you don't look bad at the Spurs. So we can fill in the back, we can fill in the front. We can do it for women too. For women, I normally start out with placing, starting with platelet-rich plasma and doing the laser resurfacing. Only the laser resurfacing brings the blood flow, and the PRP helps to thicken whatever hair you have. It doesn't make new hair, but it just thickens whatever you have. If you want actually new hair, then you'll have to do a neograft, which we do in our office quite regularly. Anybody that texts in tonight to 210-270-8595 with their name, email, phone number, and locks in a deal, or at least just wants to talk, is going to get $500 off their surgery, their neograft, their facelift, their neck, their ear pinning, anything. So just let me know about that. Last thing is incisions. With ear pinning incisions, all the incisions are behind the ear. I'm gonna turn around real quick. All of them come here. You don't see them. And it is life-changing to have to otoplasty. I mean, I know women who we take off their bandages and they're just so happy. Laura Alaman gives us hugs, kisses, and I don't know what that last emoji is. Lisa Salvar gives a hug and something else. Man, I just don't have my glasses today. What the heck was I thinking? Anyway, Yvonne Alejandro, I love looking at your lives. Thank you for watching. They're really hard to put on sometimes. We put up a $500 off, but you have to text us tonight. $500 off when you text it to 210-270-8595. Yes, Ashley. Oh, I thought you were going to ask me something.
I was gonna ask you that if I'm not ready for like a facelift, can you just do Botox to raise your eyebrows?
Okay, so people ask me, what's the difference between facelift, Botox, fillers? So Botox and fillers are good as deterrents. And deterrents can be things that just kind of start to relax, give you that more of a relaxed look. It does not do what a facelift does. If you're not ready for a facelift, things just aren't the cards, you don't have the time off. Um, uh, my friend Eric says, do you wear glasses in surgery? Yeah, you changed. So, um, those things are good because they at least get your foot into the door, and you're able to understand that the skin and the underneath the soft tissue is different. Seja says, se envías un texto con tus datos al número al Dr. Jeneby. Oh, so Seja is translating for us. Thank you very much. You're starting to become one of my favorite people. That in Spanish, what to do to get your $500 off. And she's putting include el nombre completo y fecha de nacimiento al número enlistado arriba. Joe Cirillo says, what companies can we get approved for this surgery? We're going to put down, it's a great question. We have Novo. Can you remember that? We're going to send it to you right now. Stephanie's about to hit 3, 2, 2.5, 2 3/4, 1. There it is. Care Credit Novo. Joe, if you looked, we just answered you. You get on a Care Credit Novo, get everything pre-approved. But here's the thing is, you got to pre-approve for at least a face, stuff with the face, like a facelift, neck lift and stuff. You're in the 10,000 or more range. Stuff for like an ear, you're in the 4 to 5 range. Stuff for Botox and fillers, you're in the 3 to 5 range. So make sure you get pre-approved enough. You're welcome, Joe Cirilla. If anybody in Instagram wants to know that, let me know. Oh, we do have more surgeries live tomorrow. Yesterday, if you look at my feed, we had a male tummy tuck and we had a female mommy makeover with arms. And she did really, really well. For those patients, we always put them in the hotel with a nurse. I personally go and check on them the next day. I text all you guys that night as well. But suppose you're not ready for everything. Suppose you're like, I just don't want to do this or that, or some of these surgeries are big. For a face, again, we can start out with some laser resurfacing, fresh in the face, start you on some good skincare. We can use a Secret. The Secret is a micro needling. It takes these needles at 25 pin needles, puts it in the skin, delivers heat. It's very comfortable. I'm a huge wimp, and I can tolerate it. And then what we do is we place the platelet-rich plasma in the channels. Now, just putting platelet-rich plasma on your face without doing some type of channels, either with a microneedling, a laser, or something that'll create channels, is a waste. I mean, because your skin is the #1 barrier. Let's see. Somebody just said, Dr. J, what come? Okay, never mind. I went off. Seja put ellos ofrecen financiamientos y necesitar ser aprobados. I have to look all this up. Seja, you're wonderful. Thank you. We have our own translator. We did not ask her to do this. She's awesome. She's just doing it for us. Lisa Salazar. She wants a mommy makeover, but really just a tummy tuck. That's your goal. Oh, that's real nice. Lisa, we can help you get that goal. You can even prepay for your surgery if you want ahead of time. We accept prepayments. We've actually done layaway for people for years. I had one lady pay for her breast lift for almost 4 or 5 years. It was awesome. And she had a great breast lift after that. And we just put up, Lisa, you can do a prepayment plan. You can mix between credit card, Credit Novo. We have ways that you can do 65 to 75% down, depends on what you're getting. And then you can use the rest on credit. I mean, we finance at least at this point, we're financing a lot of people. And it just helps because sometimes you just don't have it all up front. And we understand that. I mean, these are big investments, but that's what they are. They're not an expense, they're an investment. And what are you going to do? Buy a truck, buy a car? Yeah, I think you just put that up there, right? You're on YouTube. So yeah, we just said we have prepayment plans, the whole thing. We're going to be taking this and putting it on our Facebook and our Instagram, and then we're going to have a copy of this on YouTube. And what we do is we then do a SEO. I'm sorry, we do a translation by rev.com, and then we're gonna have that translated, and then you can push Spanish translation on it and tell people. These will also be put up on the website. We have our August specials. Just to let you know, the August special of this month is on liposuction, and it is 6 areas of liposuction for $49.99. That's a $2,000 savings. 6 areas: upper lower abdomen, possibly upper lower abdomen, flanks, upper back, mons, arms, upper lower abdomen, flanks, whatever you need.
Laura.
Danny Guzman, wish I could get a mommy makeover. Well, we can help you with that. Laura Alaman, can I go in for a free consult? Laura, yes, you can. Can you text us to 210-270-8595 right now? Laura, 210-270-8595. Write that down. Text us. We put it all over these sites, and we'll get you a free consult. We also have in my Spa Black, we have 80 units of Jeuveau, which is the new Botox, for $7.99, and we also throw in a microdermabrasion for that price. So excellent, excellent, excellent. You're getting a value add to the service. You're getting a microderm where you wouldn't probably get one. Kani Murdo says the word French. Does that mean French bread? Not sure what that means, but we're going to see in a second. So just remember, our specials for surgery are $49.99 for 6 areas. The spa special is 80 units of Jeuveau for $7.99, and you get a complimentary microderm. I mean, these are great, great prices. You can use 80 units in a day. You can use it over 2 days. Joanne Flores, we perform a mommy makeover on an 82-year-old. Whoo! I've never said never, but we definitely have to see your health first because, you know, it requires you to be under anesthetic. And anesthetic can have his own issues. So we'd have to just see you. Yes, Lani Rodriguez says, does a Jeuveau work for forehead? Yes, it does. I have it in my forehead. I don't like to be completely frozen like this. So I like to have a little bit of animation. And you can see that I have some animation, but this is not the forehead of an almost 50-year-old man. Awesome. I don't think so. Why are you laughing? She's laughing at me, but that's okay. She's over there giggling because she knows I'm right. But anyway, how can I see you about hernia surgery? Well, I don't do hernia surgery for insurance, but during a tummy tuck, for example, I'll fix it for you if it's not too large.
Do you speak French?
Carrie-Ann Myrtle, no, I don't speak French. How do you say no, I don't speak French in French? Hook me up.
I got you.
Okay. Karine, I'm so glad. I think you're talking to us from France. Lani says, I look great. Seek Ashley, she thinks I look great. So, Ashley is laughing at me. If you don't know her, she just likes to laugh, and I'm going to show you her right here just laughing at me. Right, there you go. Okay, good. The girls love it when I laugh. Okay, ready in French? Non gêné par français. I hope that works. Non gêné parler pas français. I did get engaged in France, though, at the Eiffel Tower. So, Lonnie says, you look great, Dr. J. Thank you, Lonnie. I'm waving at all my buddies on Instagram. You guys are lovely, lovely for joining us. Joe Cirillo, how long does Jeuveau last? It's been lasting now. I'm in my almost 2.5 month. Oh, Canet Myrtil, Montreal, Canada, one of our favorite places, isn't it? What a gorgeous place. If you guys have never been to Canada, when we go off topic. Oh, there we go. Say how nice. Non parler pas français. But you can translate this on Google, Karine. We're gonna get this translated, put it up on our Google. We'll get the we'll give you guys the HTTP, and then you can push translate into Google, translate on YouTube into Google, into your native language. Roma TV says hello. Roma TV joined us. Man, a lot of you guys here tonight. I guess it's kind of a boring night. So you. What's that?
They missed you.
They did miss me. I wasn't on last week because once about homeboy needs to go take a vacation. So, so that's with that. But again, back to the skin. Who won the school supplies? Okay, so guess what, Stephanie, you're gonna have to pick a winner. Today we're picking a winner of the school supplies, which is a backpack full of goodies. Or Tanya is gonna announce it. Just look on our website. I'm sorry, look on our Facebook, and she will announce the winner of the school supplies, which is a backpack full of goodies, which we'll shop for you for. Carrie Murtel, okay, she will do it. So make sure we translate this in by rev.com, because then Karine can look at this in French. Claudia and Lopez, it's because we love you. Mary, thank you very much. I got an awe from my producer over there. This teacher needs it. She's not dropping any small hints, Stephanie. Do you hear her and see it? So, Lonnie, we hear the hint. I think we get it. I think you're getting very close. So that's awesome. We appreciate you being on there. And I think you tried to drop it like it's hot yesterday on us. And I saw that post. So anyway, do we offer teacher discount? Yes, I love teachers. Amy La Rose. Again, if I'm butchering your name, I can't see
Aaron
very well.
LaFosse.
I'm sorry, Aaron LaFosse. Eric Williams, one of my best friends in the world. Dr. Williams, urologist. He, one of the best urologists, one of the best people in the world. Huge redneck, but I still love him. Certified redneck. I mean, hunts and fishes and does all that. So love you, Eric. And Bella, we love you too. You're awesome. I know Bella and Eric. I know Bella for a long time, since she was born. Lonnie is just loading up on emojis right now, bitmojis or whatever there are. Back to some serious points, some Botox. Under eye wrinkles, combination Botox, laser resurfacing, or surgery. Under eye bags, 99% of the time surgery. Cheek, when the cheeks start moving to the bottom and giving you these creases, fillers or a facelift or both. Neck, when the neck starts sagging, you can. Somebody put watching your magic. You work your magic on scope or scope. Oh, thank you very much. Who was it that said that? It just faded out. Seha says back to school discounts. You guys are real funny. You guys are extra tonight. But anyway, back here, the neck, liposuction, neck lift with incisions that go inside the ear and back to the hairline, as well as inside the ear and back to the hairline. As far as otoplasty, the incisions are, I lost my little thing. Yeah. Incisions for the otoplasty are behind the ear, like this, and then the ear gets pulled backwards, okay? Incisions for the lower lid bleph are right along the lash line. You never see them. The rest of the incision goes in the side of a crow's foot. The upper lid is 8 millimeters above the fold, above the lash line, and the endobrow incisions are in the hairline. So there you have it. It's going to be time for me to jet here. Any last second question, you better get them in, because at some point I'm still jet lagged. So eventually I have to go to sleep. If you want to do a virtual consult, I'll be around for the next 5 to 10 minutes. You can go on my website or type in any of the HTTPs that we sent up to you, that we've had already to you. We've sent it all to you to get a virtual consult. Remember, I'm the only one that sees it. I don't mention it on the air. I never let you, I never break my HIPAA confidence with you. I appreciate, again, watching us tonight. You guys have a lovely evening. I've got to send my producer home because he's got kids and he needs to get them ready. What are you looking at?
He's looking for the doxy time.
Oh. So anyway, we're ending. I appreciate you. Here comes a Doxing Me consult on both sites. It's going to be on the Facebook site, and she's going to put it up on the Twitter site here in 1 second. And then I will log into Doxing Me for the next 5 minutes. Seja, muchas gracias y gracias por todo. Say hi. She did a great job. Translate. Hopefully she stays with me every week. Isabel Lana said, I need a tummy tuck. My daughter left me looking pregnant. Yikes. So it's time to call us. Even if you're just thinking about it, we can at least get you in the next couple of weeks. If you're not serious and you just want to talk to someone, or, oh, I forgot to tell everybody. Shoot. This Thursday, early, like 4:30 to 5:30, you can come in for a quick 10-minute consult. But then I'm leaving by 6 o'clock on the dot. So we'll be available then because I still am seeing patients late because I haven't been there in a long time. So Laura Alaman says she already texted us. Is that right, Stephanie? Laura? Oh, okay. Laura Alaman got $500 off. You get 500. You get 500. You get 500. I make them laugh all the time. All right. And Stephanie's laughing too. And the only one's not laughing is Ashley. So we're going to make her laugh today. All right. Thank you, everyone. You guys take care. Thank you, Stephanie. Thank you, Joe John. Thank you, Ash Bash. And gracias por todo, Seha. Okay. Pauline Manning Marison says, hi, do you miss me yet? Yes, we do. Adios, guys.